Hi, I'm Jill Zarin from the Real Housewives of New York City. Thank you for watching this video on Still's disease with my stepson, Jonathan Zarin, who was diagnosed in 2008 with Still's disease, and we're here to help inform you about what's going on with the disease and what the future holds for you. As you can imagine, anyone whose child presents ill in any way, shape, or form is, scared. But you're more scared when your child is in a life-threatening situation, and at the same time, you don't know what's causing the problem. The night of the first episode of the premiere of The Real Housewives of New York City, we get a phone call that Jonathan's on his way to the hospital. And, funnily, Bobby and I sort of look at each other and said, well, let's watch the show first, and then we'll head over. And then we're like, no, he's going in an ambulance. There's got to be something seriously wrong. So we end up at the hospital, and we look at Jonathan, and he's in horrible, horrible pain. And we don't know where it's coming from. And of course, we ask him, did he drink something? Did he take something? Did he eat something? And I really think that the emergency room didn't take it seriously because of his age, being a male, New York City, that it could be drug-related. So immediately they do all these blood tests. And a few hours later, after waiting patiently, we find out that Jonathan, in fact, had a heart attack. So the blood test came back that he clearly had some kind of a heart attack, and they got a little nervous. So now they start calling in specialists. Clearly he's getting admitted. He's in the ICU, and his blood work is not good, and we don't know what's wrong with him. And more importantly, though, was he was in so much pain. He was literally screaming. Jonathan's a pretty strong kid and has a high threshold for pain, we learned, but was in terrible pain. So I never left the hospital. I think Bobby actually went home. But I never left his side. We stayed overnight. So his refraction rate was 20%, and he was going, if it continued, he would be in heart failure and need a heart transplant. And as soon as I heard those words, of course we started to cry. We were devastated. And one of my dearest friends does work at Columbia University. She used to be a heart transplant nurse and now sells heart transplant equipment to the hospital. And I called up Monique, and she ran over to the hospital and at the same time was calling Columbia for permission to transfer. And normally, hospitals don't like to take dying patients, and Jonathan at that point was a dying patient. But through, God and friends, we were able to have Columbia University at 11 o'clock at night go to Beth Israel and pick up Jonathan. Not to say Beth Israel wasn't a fine hospital, but it wasn't in the same category as Columbia is in the heart department. Now is very different than it was, let's say, even 10 or 5 years ago. The internet. First place to go is on the internet, and hope people will see this video via the internet by typing in the word Still's disease, because when we typed it in, there really wasn't much. But the point really was of doing this video was diagnosing Still's disease is not an easy thing to do. It can only really be diagnosed by a rheumatologist. There aren't that many rheumatologists in a hospital. A hospital, in an average hospital, may only have 1 or 2. New York, where you were today, they have 40, but that's not the norm. And it's a very tricky diagnosis. At least it wasn't Jonathan's case because of the way he presented. Jonathan presented with a heart attack, and it was a ruling out game. Like with any rheumatological disease, they have to rule things out. So blood test after blood test, and his heart he had myocarditis. We thought he had myocarditis. His heart was, so we didn't know what was wrong with him. And the only indication that was a hint that this was Still's was his ferritin level was 24,000, which, by the way, all of the rheumatologists said they had never seen a patient with over 10,000. Wow. So this really threw them. Normal's 200, by the way. So this ferritin level of 24,000 was the only indication of Still's disease. They thought it was rheumatoid arthritis. The other thing about Still's is he broke out in a rash, but it wasn't obvious. He's a male. He's got hair. And because of the fever and the sickness, he was rashy, reddish anyway. But after reading on the internet the symptoms of Still's disease, a rash presenting is one of them, we were looking for it. And when the rheumatologist came down and I had seen a rash on his back, I told the doctor, I think he has a rash. And then I think, they didn't communicate with us to such detail, but he put together the ferritin, he put together the rash, put together the other symptoms, and they came up with the diagnosis of Still's disease. Well, I was sort of robotic at that point. If I got emotional, he wouldn't get better. I can't explain it anything other than it was a mission. I took it on as a job, as an assignment, that I had to figure out what was wrong with him and find a cure and a treatment, or a treatment and a cure. We had to find a treatment and a cure for him. And unfortunately, Still's disease is not curable. It's treatable, and we thank God for the medications the doctors prescribed. But, if God forbid there was, what scares me the most is if there was a worldwide emergency, if something happened and Jonathan couldn't get his medicine, what would happen? You tell me. Asthma. If an asthmatic doesn't get their inhaler, they die.
It's heavy stuff.
It's heavy stuff. So, does Jonathan, do you even have an extra emergency supply? And is it worth it to have it? Or does it go bad?
Yeah, no, I think you just get it every month and you have to use that.
But
it expires.
How long?
Maybe after 6 months?
Yeah, under a year.
So that's still a long time, so you can sort of like have an extra and then always use, you should always have like 2 months.
They just give me my supply at a time.
But that's the fear for me, is we were traveling once and we thought that.
But they took it. They did take it when we were on the cruise.
Oh, we went on it's a perfect example of, how, and people who are sick know that they really have to watch the medication. We go on a cruise, we get in the room early, and Jonathan correctly puts his medication in the refrigerator. Did we know that the maids would go through the ship before people were supposed to enter their rooms and clean it out? They threw out his medicine. Now, had that gone into the general trash compactor of the ship,
they would have had to fly me off the cruise.
What would have happened to him? Even in 24 hours, he gets sick. It's not like he can go a week without his medicine.
Right.
So that's a little scary. And John, that's a huge responsibility. And he's an adult. What if you were 15? What if you were 14? I guess it's called JRA. But, when you're that sick and you're on life support with medication. So we need to help find a cure for this. Well, the other thing is the disease has been known to, rear its head every 25 years. So Jonathan had it as an infant. 25 years later, like a book, it came back, which means he's looking at it again 25 years if we don't find a cure. So we've got that much time to find it for him. For more information on Still's disease or any disease related to arthritis, please go to creakyjoints.org. And you can always email me at jill@jillzarin.com or visit my website at jillzarin.com.